Hello, ladies and gentlemen. Today we shall present our work named IoT devices and their use in monitoring the COVID-19 patients. It's going to be a literature review. This work is presented to you by غزلان خبابة, a PhD student, and Kاميليا بليدة, an associated professor. From the diagnosis of the COVID-19 till its last stages of treatment and recovery, Internet of Things, also known as IoT, and the electronic devices played a major role in discovering the disease, monitoring the patient's vital checks and their surveillance, which led to a better healthcare system and an outstanding economical. The problem resides within which are the most used IoT devices to monitor the patients and stop the spread of the disease. The COVID has different stages, where the first one is often asymptomatic. The patient is already infected with the disease, but they show no symptoms. The second one shows some common symptoms between patients, such as coughs, fevers, or muscle pain. In the third stage, the virus spreads to other people, and then patients start to recover in the fourth stage. The basic symptoms should be always monitored to prevent the spread or a hazardous outcomes on the patients themselves. We shall start our presentation by giving some common definitions. Then we have to compare between the IoT applications used to monitor the COVID-19 patients. We have some of the most faced problems and limitations within this application, and we finish our work by a conclusion. Internet of Things, or IoT. It is known or described as the network of physical objects, things that are already embedded within software, sensors, and other technologies for the purpose of connecting and exchanging data with other devices and systems over the internet. Like we can see in this picture here, we have the cloud. The cloud here is the main source to store data, and we have all these devices that are connected to this cloud. All these devices have information that need to be. We have also the Internet Medical Things, IoMT. It is the collection of medical devices and applications that connect to healthcare IT systems through online computer networks. Most of the common used medical devices in the European Union and the FDA of the United States are listed as follows: gloves, gowns, or any dressing element, medical face masks, flow meter and oxygen sensors. We have blood pressure monitoring kits and CT scans. We have here a patient that is already wired with some other device. Here we have a room that is specified for a COVID-19 patient. We have here the sign stop where we can't enter this room. We have a nurse and an electronic checker. Here it shows that the vital checks of the patient are monitored periodically. We can name this one room a ward. A ward is just a room where patients are isolated and monitored 24/7. We have also in another type of ward where all these electronic devices are rearranged in a sort of way that can record the vital checks of the patient, just like the previous system, But here, what they are adding is an alert that a patient is calling. Ladies and gentlemen, this system brings more information than the previous one. In the previous one, the doctors has to go and check the patients on themselves, but here the patient will call the doctor to come and check on him. This is the main difference. The main difference here brings an addition to the healthcare system, which is doctors do not need to be tired all the time from going back and forth from one patient to another. They go and check the patient if they call them. Other IoT applications were used worldwide, and even some of these IoT systems were for the post-COVID life surveillance. After getting infected and after recovery, you need to maintain a space from others in order not to get infected again and in order also not to spread the disease. The most common limitations of all these systems can reside within the follows: the lack of a standard architecture for all these IoT systems, where the communication is different from one system to another, and the security and the privacy of the patient's information is always in display. We have also another major problem, especially for the third world countries, where the technology is not available for all these countries and their prices are off the roof. That the stack prices of the equipment are so high and not all countries can get the equipment. We have also the undeveloped economies that will face a major task, which is they cannot get these systems to work within the current systems, within the current healthcare systems. The lack of knowledge here is a major drawback. You cannot give a new technology to doctors who are not familiarized with these environments. In this study, a literature review was done on the IoT applications that were developed during the outbreak of COVID-19 in the health domain. The main contribution of this review is its focus on the newly developed applications to face the crisis of COVID-19. Thank you for listening.